A new study by the University of the Western Cape School of Public Health reveals 1 in 5 South Africans over the age of 15 live with more than one disease. It also found that women are more prone to what's called multimorbidity, which is the presentation of 2 or more chronic conditions. Hypertension, anemia and HIV are most prevalent. Now, PhD candidate Rifqah Roomaney conducted the study and joins us live from Cape Town. Rifqah, thank you so much for your time this evening. Just off the bat, I mean, people might have listened to that introduction now and sitting on their couch saying, oh my goodness, do I have multimorbidity? To start the conversation, just give us a simple explanation of what multimorbidity is and why we really need to pay attention to it.
Hello, everyone. Thank you so much for this opportunity to be here. So what is multimorbidity? I think you described it pretty well, which is basically if one individual has more than one disease. So, for example, if I had diabetes and hypertension, I would be considered multimorbid. And if you are wondering if you have it, then you should probably maybe go to your doctor, get screened.
And now we're told that multimorbidity is known as a quote-unquote a global research priority. Why is it important to take note of whatever the certain grouping of diseases are that you have? And there is, of course, a focus on hypertension, anemia being and diabetes being major issues in South Africa. And, of course, we still do have the highest HIV rate in the world. Are we only now in the health sector taking note of people who are suffering from more than one of these? And how does that impact on how they should be treated, medically, that is?
So this has been a concern for some time, but I think it's been very difficult to actually monitor the data. So there's been smaller scale studies, but it's difficult to get national data on the prevalence of multimorbidity in South Africa. And of course, like you said, we've got a huge HIV burden and non-communicable diseases. So we have all these diseases that we need to focus on. But I think it's not been made as much of a priority as it needs to be. And of course, the way that it would impact medical care is that you are being seen for more than one disease. So you definitely want to have access to integrated patient-centered care. You don't want to be sent one place to see a chronic disease doctor for this and another doctor for something else.
Now, you did this study, obviously you're with the University of Western Cape School of Public Health, but you did it in collaboration with researchers from the SOPH, the South African Medical Research Council, as well as Stellenbosch University. Tell us a bit more about the study, how you went about it, and what was the pool sample that you were working with?
So as part of my PhD project, we collaborated with these different institutions. We wanted to basically know what the proportion of South Africans have more than one disease. So what we did was we analyzed data from the South African Demographic and Health Survey. And this survey collects information on they basically have field workers that go door to door and they collect information on whether you have bronchitis, heart disease, cholesterol, stroke, and TB. They also take blood samples, check that you have HIV, diabetes, anemia, and high blood pressure. So how we did this was we took the data set and we basically analyzed it.
And of those findings, one of the factors that became a thread throughout is that multimorbidity seems to be fairly common amongst women of reproductive age in South Africa. Through your research, obviously those numbers would have been fascinating to come up with, but what did you get any inkling as to why that might be the case here in South Africa?
So multimorbidity it seems to be quite prevalent in South Africa, even at younger age groups, like you said, women at reproductive age. We think that is it's probably related to the HIV burden in South Africa that does impact younger women. Of course, it impacts everybody, but younger women specifically.
And then when we speak about non-communicable diseases such as diabetes, hypertension, you spoke about cholesterol earlier as well. A lot of those would be connected to lifestyle. It would be connected to nutrition. Are you able is the data that you've collected, would we be able to use that data to pinpoint that this also affects those in the lower income demographic more seriously than in others? And are these issues within the communities that we need to focus on through primary health care and the like?
So part of the research is that we try to find where the high-risk groups are, and so, but I think more research is needed on this area to really pinpoint where we need to focus on. But it's likely that in low-income areas, people probably do not have maybe access to some of the healthcare, maybe some screening, that we would get with private medical aids, so that is definitely an area to focus on.
This was part of your PhD project. Where are you hoping to go with this information? Because it could have a life-changing impact on so many South Africans.
I think that we really want to highlight that this is an issue. I mean, we all know people that live with more than one disease, and it impacts not only the individual but their families. It impacts the health system as well. So I'm hoping that this will hopefully pave the way for some more research into the area, and hopefully that people that are multimorbid can get the care that they need.
Okay, we hope so too. PhD candidate at the University of the Western Cape, that's Rifqah Roomaney, telling us more about an interesting study that she's done on multimorbidity, a very serious issue here in South Africa.